Hi, I'm Dr. John Chessare, the President and CEO of the GBMC healthcare system, and I'm here to give you our now weekly update on the pandemic. Well, you've seen in the news that things are starting to get better throughout most of the United States, starting with the East Coast, where the Omicron variant first got in action. As a reminder, the Omicron variant is very highly contagious, so it has spread very rapidly through populations across the country. On average, it creates somewhat less sickness. There are more people infected, but on average, fewer of them have needed hospitalization, and on average, fewer of them have died. As we said last week, though, because so many people have been infected, even though the percentage of people getting sick is lower, there have been many more people getting sick enough to make it into the hospital. In Maryland, we are now below 3,000 Marylanders in Maryland's acute care hospitals, either in a regular bed or in the intensive care unit. We got up over 3,500, but now we're below 3,000. We reached the 3,000 number back in early January, so it is now clear to everyone that things are starting to get better. The emergency department is seeing fewer patients, both because there are fewer Omicron patients, and also because the public has taken heed of the message that we've asked them to not come to the emergency department if things are not truly an emergency. We've asked people not to come to be tested, and they have listened. And the state of Maryland has stood up new testing centers, which have also helped to take the burden off the emergency department. What about the situation at GBMC today? So right now, we have 57 people in GBMC who are COVID-19 positive. And of those 57, 10 are in the intensive care unit, and only 2 of those 10 people have been vaccinated. We have had 4 deaths over the last 2 days. So the Omicron variant creates serious illness in people who are immunocompromised, are elders, have serious pre-existing medical problems, and have not been vaccinated. So again, we should be asking ourselves, what have we learned? What is likely to happen next? So we've clearly learned that this virus mutates readily, and we should be ready for a next mutation and variant. We don't know if one will be created that will create serious illness. We don't know about the effectiveness of our existing vaccines against a variant that may pop up. But we have learned that for the variants we've already seen, that being vaccinated is excellent protection against hospitalization and death. So we should continue to implore our friends and neighbors who have not been vaccinated to get vaccinated. And as the President of the United States said yesterday at the news conference, we should be supportive of interventions to immunize as many people across the world as we can. As you will recall, Omicron started in South Africa because very few South Africans were immunized, and it was a fertile ground for the creation of new variants. We are hoping we get to the point where COVID-19 continues to exist in the population, but at very low rates, and we have the immunologic protection in place with most citizens such that we don't get big outbreaks. We hope that we get to the point where we just continue to immunize the population, most notably babies, such that we can maintain the high levels of protection against this virus, just like we maintain high levels of protection against chickenpox, measles, and the mumps as examples. Some of us remember those diseases. We haven't seen them in any great numbers in many, many decades because of standardized immunization policies, because of laws and rules that prevent people from entering school who have not been vaccinated. And because of those laws requiring vaccination at school age, everyone is protected against mumps, measles, and chickenpox as examples. So we want to get to that point with COVID-19. Again, we don't know if another variant will pop up that is highly contagious. We don't know if a variant will pop up that can get through the protection created by existing vaccines. But we should do what we know works today to reduce the probability that a new variant gets created that can wreak havoc on our citizens. So again, the messages are clear. Please get vaccinated and boosted if you have not already been vaccinated and boosted. Please continue to wear your mask until the public health officials see that the risk of infection is low enough such that we don't have to mask. Please stay socially distant, especially if you are surrounded by people for whom you do not know their immunization status. And please wash your hands. So again, the pressure that has been intense on our hospitals, especially our doctors, nurses, and other clinicians, is getting a bit lower. But thank you for doing your part, because they are tired and we need to give them a bit of a break. But GBMC is here for you if you need us. We will be opening, the state of Maryland will be opening a testing center on our campus. We are looking forward to that. It will probably be open by next week. Watch for news about this at www.gbmc.org. In the meantime, we have our own testing center open. If you're not sick but you need to be tested, please go to www.gbmc.org and sign up for an existing testing appointment. If you are a GBMC Health Partners primary care patient, you may sign up for testing using our MyChart application. So again, thank you for everything that you've done. Let me give another shout out to all the clinicians across the state and all the first responders for their fabulous work in getting us through on our way down from another surge.